Hello and welcome. I'm Manvi Dhillon and you're watching ET Now and Samsung present Biz Bites, a show that explores the impact of technology on critical sectors of the Indian economy. Today the spotlight is on healthcare. Let's meet our panel. Dr. Ruchi Das, CEO of HealthCursor. Dinesh Lodha, Vice President, Health and Medical Equipment Business, Samsung India. Dr. Sanjeev K. Chaudhary, Managing Director, SRL Diagnostics. And Mr. Suresh Soni, Chairman, Nova Medical Centers. If you had to, Dr. Das, reflect on the big trends as far as Indian healthcare is concerned, what are the top three you would pick?
I think 5 years back when you used to talk about technology, it was always related to the medical precision technology or technology that is related to lab tests, cyber knives, and so on and so forth. Now that change is coming where people are moving more to better and efficient systems, more productivity, and there is budget allocated for mobile technology enterprises, innovations into healthcare delivery models. I think that has changed a lot.
Well, we're going to talk about what more is on the horizon, but here and now, Mr. Soni, what do you hope to achieve via technology in healthcare?
So simply put, technology is to be used to make quality healthcare affordable and accessible to the masses. This is, through the various mechanisms, various technology platforms that have become available. And, we have a very large country, billions of people, and making these scarce resources available, accessible to them is what the intervention with technology and healthcare, that's what it means to me.
Make it real for us, Dr. Chaudhary. Walk us through how technology has actually improved processes at SRL Diagnostics.
A company such as SRL, which performs over 100,000 tests a day, there are many layers of technology. One is clearly for process improvement, making sure that samples are accurately accessioned, tested for right parameters, but that's an internal process.
Yes.
For a prescriber, that's a doctor, and more importantly for the patient to whom the sample belongs, the only measure is how quickly, how accurately the report reaches both of them.
And how conveniently.
How conveniently. And that's where the confluence of technologies is taking place. It's not just existence of data, it's how it's pushed into the mobile device of a patient, how it is pushed into a smartphone by way of an app, and therefore the need to have innovative technologies to drive down cost, improve convenience and accessibility paramount.
You've talked about, sharing of information internally, externally. Let me just link that up with electronic medical records and why there is a increasing focus on that. Why are they so important?
So for example, you go to buy a dress, you need a reference. You need the size details, you need the preference of colors, and you need so on and so forth. Much more serious is healthcare. That is the difference between using electronic medical records, setting a reference, knowing the person, being familiar with the patient when he walks in, and then guiding him to the treatment that he or she can afford, can actually adapt to, and can actually help him rehabilitate. So that is very important. Today, when patients are asking for better quality healthcare, electronic medical records are now catching up the pace.
But Mr. Lodha, when you reflect on technology in healthcare, where are we today and what's the potential?
Absolutely. You are leveraging our core technology of consumer electronics and mobility and converge that to create a world-class solution. I'll give you some example. We have created a blood analyzer, which is just a 2 kg weight, and that can be mobile and can do the blood analysis in just 7 minutes. Now that will increase access. It can remotely connect it anywhere and you can access that report, right? On the same side, on the healthcare equipment, we created a technology we call 5D technology, which can have the unborn baby view in a very different way, which can have a great clinical sense.
Technology is really pushing the boundaries, but then you have regulation, and that's a part of the reality. And I haven't got a blood test result in 7 minutes. Why is that, Dr. Chaudhary?
I think what Dinesh mentioned is true. There are technologies available, such as the one Samsung's brought out beautifully. In India, we have regulations that sometimes do not keep pace with the needs of the market situation. We have a law that requires that a pathology test report is reviewed and signed off by an MD pathologist. Now, the number of MD pathologists in this country is less than 40,000. whereas the number of tests performed on any day is over 1 million. And therefore, how do you get the two together? I think you need more technology. You don't need the physical supervision of an MD pathologist if the equipment can be remotely monitored, if the calibrators can be correctly devised, if there are accreditation standards that make it possible.
I still want to get a feel, Mr. Soni, of how technology today is helping you run a more efficient hospital.
There's a whole technology bit in terms of, making scarce resources more available or enhancing their productivity. For example, when we talk about electronic medical records, today this information is on the cloud, accessible from home after all the work is done. So this improves, the patient experience, the patient time. Similarly, like Dr. Chaudhary was mentioning, telemedicine, when we have scarce resources. Today, India is leading, in these areas. I mean, telemedicine, when you talk about radiology, the number of radiologists that we have in this country, scarce resource. But we are providing this service across to the United States. So, in spite of the hurdles that we have in India, in terms of regulatory environment, but some of the work that's being done is world leading, and we have to be proud of it.
Dr. Das, mobile technology, why is it beginning to play a bigger and bigger role?
Why mobile is your question is because that's the most ubiquitous and pervasive technology today. Rather than creating an infrastructure and then building upon it, why not use something which is already existing and then you build upon existing? So what does mobile technologies do? They build access. So everybody has a mobile phone, everybody is connected, and not just mobile phone. This is a misnomer that mobile health means something related to mobile phones. It's actually wireless. It's anytime, anywhere healthcare. It could be your radio sets, it could be your set-top boxes, it could be your mobile phones, it could be anything. Second, it reduces cost, the transportation cost of going up to a clinic, coming back from there, and the time that you actually kill doing that. Third thing it does it, asset management. Whether it is the lost man hours, lost bedtime, lost maybe the payment modules. Number fourth, it actually builds in efficiency into the system, which means that things are now more fast, easy, and accurate. And fifth and the last thing, it actually creates communication, which is very important. Continuous communication between the patient and the doctor is imperative for a better healthcare outcome. Now we have sensors. A Band-Aid or a patch can actually do a CT scan or an MRI on a daily basis. You need not transcend sounds on a daily basis today. I can actually use my mobile phone to see my bioconductance. But more technology actually also means that you need to take doctors along with it.
The entire medical community has to
come
geared
together
to embrace that technology. We'll talk about that in greater detail. Right now we're going to take a break, but we're going to leave you with a glimpse of how technology is transforming Indian healthcare. Ultrasounds, the future is here.
When we got into imaging, that was way back in 1990. And at that time, radiology and imaging techniques in the country were very rudimentary. Since then, of course, there's been a sea change. From Samsung, we've been using their ultrasound machine, which is a 4D ultrasound, state-of-the-art equipment.
So we've started a partnership with Samsung using one of their core strength areas, which is ultrasound and display technologies. And our first machine that we've actually bought from them is a women's imaging oriented machine. And that's again the good thing, that a lot of the machines are not just machines, but they're solutions driven. So it's bringing in efficiency, it's bringing in accuracy, it's bringing in the fact that we're able to visualize and demonstrate what we want for our referring doctors to make the right decisions for their patients.
It has features such as 5D and photorealistic view, which definitely help us make better and accurate diagnosis, and also in turn help the clinician in decision making. Features such as automated measurement, taking abilities, reduce the scan time and make it easier for us as well as for the patients.
Welcome back. You're watching ET Now and Samsung present BizBytes. Today we're examining the role of technology in Indian healthcare? The idea of mobility is actually a very large one. Is it viable in the Indian context? So therefore, Mr. Lodha, I ask you today, mobile technology, is it finding greater play in the big cities? Is it finding greater play in the rural areas, or is it an equal balance of both?
I think it will be equal balance to both, but let me give you example, two diseases in India, which is one of the biggest killer. One is cardiac and one is trauma. And how mobility can help this too. And that is where Samsung is now coming out a lot of solutions. We have launched a cardiac marker, which is basically can be fit into your ambulance. And when you have attack, when patient is coming towards hospitals, this can do the complete analysis and send the all report through the mobility to the hospital. So by the time, which is the golden hour, 1 hour, which is the most critical in cardiac, you can have the report already done during the transit.
I get that totally. The role that mobile technology or mobility can play in emergency care is huge. I want to look at mobility, Mr. Chaudhary, from the point of view of doctors first. Both your opinions on that. Dr. Chaudhary, would you like to go first?
Let's take a specific example. There is a patient who has come up for an investigation, and the doctor wishes to know that if the sugar values are above a certain number, it makes it possible for laboratory today to send what is called a critical call out. A text message goes to the doctor. The doctor knows that this patient needs immediate attention. Text messaging is a virtual zero-cost technology.
Sure.
You don't even need a smartphone for it. And that has become the carrier of critical medical information between and among the medical fraternity.
How does it all come together in your experience? Does it result in better care for me as a patient?
You have various diagnostic equipments today. You have lots of tests that are being undertaken on a particular patient for a serious situation, and all these systems are made by different manufacturers at times. All of this data to come together, having a common interface, being interoperable, is being made possible by technology. And if it happens to be a number of surgeons or doctors who are looking to do this, today it's all coming together seamlessly.
Let me play the role of skeptic as usual. Dr. Das, how much of a reality is this in India today?
Consider a doctor who is doing a ward round. Now, when a doctor is doing a ward round, he is actually doing a critical clinical procedure which actually ensures that a patient gets quality and safe care. It also brings in multidisciplinary teams together to actually plan a coordinated care and to actually discuss it with the carer and have a shared decision in care. Now, when you actually do all of this, you need a lot of technology to get all the records by the bedside, because in India, where the doctor to patient ratio is pretty steep, doctors are sometimes reprimanded for wasting a lot of time doing ward rounds rather than attending patients. So that is case number one. Case number two, being a physician myself, I can tell you that we are driven a lot by diagnostics, which means that if we get accurate diagnostics, the job is half done. Diagnostic industry is today marked by 3 words: resolution, sensitivity, and depth. If you get all of these 3 correct through technology, our work is actually half done. We can actually produce a prescription and a report, and it becomes faster.
Okay, message received loud and clear, but I want to just understand, Mr. Lodha, when I say mobility, is it the beginning and the end is the phone in your hand, or is it much larger? Expand on that idea.
If you see the hospital setup, one of the big time-consuming is OPD department, where people are waiting for hours together really to have appointment. What we have developed, which is called OPD solutions, where we have a completely tab-based solutions, where all the patient main information is already there, and all the things will be right in terms of in the tab digitally, all the information like weight and all outside. So doctor, when he go to the doctor has all the basic information, so he don't spend that much of time. So you say what is 20 minutes today, what he spent on the patient, he can do the same job at 10 minutes. Same in the hospital setup. Doctors go, if you see in the round with the papers, how we can digitize. And that is where we build the solution where doctors can just go with the tab and everything being written on the tab, you can write the tab. And more importantly, it is connected to the PACS system of the hospital, so it can be digitized, stored. Now that will change the whole, 2 things will happen. One, it will improve the quality. The second, it will improve the access within the hospital of the records, which is a huge issue even today.
The buzzword today is BYOD, build your own device. It could be a mobile phone, it could be a laptop. Key thing here is digitization of information. which is allowing it to travel to the end user, be a patient, be a doctor, be to a service provider, to an insurance agency, as well as programmable logic, which is being embedded in these equipments, which brings it all together.
We're talking about smart cities in the country. We're talking about a smart healthcare environment in India. What does it mean to you, Dr. Chaudhary?
Well, I think the prevalence is very much deeper than any number would ever throw up. And the reason is a simple question: who needs healthcare? Every single person needs healthcare through their life. And if that is the situation, then you need data, you need information, you need accuracy, you need coordination. And we have to forget that the disease burden of the kind that we have in our country, it's imperative that we make it possible for people to stay healthy. So therefore, if they have any kind of mobility device in hand, the healthcare needs to dovetail into that empowerment that already exists. That tool is probably occasionally used for answering calls, but it becomes a health management tool.
That indeed is a very, very true point that you've made. We're going to take a look at how mobility is really transforming emergency care in India.
And what we are trying to do is how we can have a complete solution on a mobile van. So what we did in the ambulance, we can have a complete CT, complete digital radiology, complete ultrasound, and complete blood analyzer. Everything can be set up in a mobile ambulance and can be going to any place. And we're working also with the government in terms of how we can have this ambulance can be done at a remote location. That will solve the access problem what you have today, because you cannot set up diagnostic center everywhere, but if you can have on-the-wheel diagnostic center, that will change the way healthcare has been served today.
Well, let's take a look at how technology is really on the ground transforming today emergency care in India.
Technology has helped us to converge all the pieces of information at the bedside, or you can say point of care. Now it is possible, and Samsung is one of the companies which has done very well in this whole effort to aggregate this information, but not only from inside the hospital, but from actually remote also. Now with remote mobile, it's fantastic because our ambulance reaches the accident site, okay? On that accident site, you're already sending information to us from there. You can send ECGs, you can get ultrasound, you can send visuals, all these things can arrive. So we can actually tell the team at ground zero what to do, because all the experts can't be there, but all the experts can be on this end guiding the proper treatment for them. So I think it's an important development and a major step forward in healthcare.
Welcome back. You're watching ET Now and Samsung present BizBytes. Our focus, Indian healthcare. The vision for Indian healthcare is better patient care at lower cost. Can technology make this vision a reality? That's the question that I'm posing to the panel. Dr. Das, is it fair to say that there is a pressing need today for Indian healthcare providers to be fitter and healthier themselves?
Definitely. Technology will become truly revolutionary when all the hospitals and everybody starts adopting it in one go. Now what happens today is I have electronic medical record in some form or the other, but some of the large hospitals wouldn't share records between each other, and that actually decreases the value of having an electronic medical record altogether. If you actually look at some of the hospitals who have already used technology, the technology there is there, but it's not interoperable. It doesn't talk to other systems in the same hospital or the chains of hospitals, which makes it very hard to drive any insights or any information out of that enterprise process, which is not integrated with each other.
I think there are a couple of interesting points that you made about, are we sharing information between medical institutions? Are we having enough communication between various branches of the same hospital, for example? Mr. Soni, I know you alluded to the fact that machines are talking to each other, doctors are talking to each other, but really, when it comes to technology, is affordability for hospitals, the big blown embrace of technology, is it limited by cost?
I think it's limited by our own interests amongst hospitals. This has been more successful across, in the Western world because of patient rights. The data belongs to the patient. As long as the patient signs a waiver or releasing the information, it is now imperative for the hospitals to share this information. He could move from one place to the other to another, or if he needs for all of it to come together, hospitals have no alternative but to share that information. We do not have that level of patient rights and the level of cooperation amongst hospitals today. The real value is in this data to be available, made available.
Perhaps technology could also push that change. Because, if you're not able to get the benefit of technology, then what's the point? And therefore, it will break through to the other side.
The easy way out is for the patient to start collecting the data and putting it in cloud himself, so he's not at the mercy of these hospitals, and then you solve the problem. But better still, if the various institutions, including the government institutions, can get past these issues, and here it comes down to regulatory environment, which has ways to improve in India.
Okay, I want to come back to the question on whether or not cost of technology adoption is sometimes limiting the extent of the embrace of technology.
Any early adapters do pay a little bit higher for technology.
Yeah.
But I think the technology has an exponential way of improving its own outcomes. And one of the critical outcomes is, well, what is technology? Do it faster, do it better, do it cheaper. Mm-hmm. And I think now the risk factor is not the cost anymore. The risk factor, as Mr. Soni mentioned, is the mindset. And that needs to change, and that needs to change not just with the private sector service providers, with the doctors, with the patients, it needs to change with the government as well. Why can't the unique identification document, the Aadhaar, become the patient identifier? The patient comes to me, I have my own number, patient goes to Dr. Soni, he has another number, patient goes to Dr. Das. So how do we make these systems work?
I'll happily trade in the 3 medical cards I'm carrying in my wallet for that one UID card if it serves the purpose.
In the US, exactly, the Social Security number
is the basis for it all.
Is the basis for everything.
Sure.
We just discovered that our spacecraft that entered the orbit of Mars cost a fraction of what the US cost was. Our lab tests cost 1/10. Our cardiac procedures cost 1/20th. I think we don't need to emulate anyone. As Mr. Soni mentioned, the heart of R&D of everybody is in India. We are easily the best, probably the most creative minds on this planet. We just need to start looking inwards, use our own intellectual ability, our own IT capability
and
to
harness
work
that
for
better healthcare in India. Easy, quick, accurate diagnosis. That's the mission statement. How then is Samsung really responding to that challenge? It's firmly out there.
So the way we see how we can have the digital world helping in the healthcare, in a hospital setup. If you start, our thing is not just talking about product, but talking about a complete solution. Starting from the time of design, how we can have the complete digitized AC solution, which can have the efficiency, productivity improve in the hospital, to have printing solutions, to have the complete room automation, how it all can be connected and it can improve the productivity and efficiency in the whole hospital. And that is where you will see more and more efficient and accurate information can be shared with the help of technology.
Sure. Final thoughts from each one of the panelists. Your vision for healthcare in India. Mr. Soni, would you like to go first?
I would say, India should, aspire to be the global destination of choice for healthcare solutions over the next 5 to 7 years. And technology will play a great part in making that possible.
Dr. Chaudhary?
Indian ethos states that we need to live at least 100 years. So 100 happy, healthy years for every Indian, that's the mission.
Mr. Lodha?
For me, I want Samsung to become one-stop solution provider to healthcare, both in hospitals and diagnostic, which help the productivity and improve patient care.
Dr. Das, vision for healthcare in India.
Well, that's a tough one, but I personally feel that I was one of those fortunate ones who got trained in technology being a physician. I think a physician and patient both need to be kept at the center of any healthcare practice or scenario. You have to train doctors in technology as well when you talk about cutting-edge technologies today. At the end of the day, the saying is, a fool with a tool is still a fool.
Well said. That's a wrap on this edition of ET Now and Samsung Present BizBytes. We'll be back next week looking at the role of technology and enterprise solutions in another critical sector of the Indian economy. But till next week, goodbye.